If you're a pharmacist, doctor, nurses, any other healthcare professional, and you're really tired of your 9 to 5, you're tired of negotiating every day as a local pharmacist, standing for 12 hours in the community pharmacy, going into the hospital. Gone are the days where you are really stuck, like you don't have many options. Today, in 2025, there are lots of things out there you can do. You can diversify without burning out mentally, physically, and otherwise. You don't need to be a prescriber if you're a pharmacist. Even as a non-prescriber, there are PGDs to cover you on this. Do 1 or 2 courses to update your knowledge, get the required certificate, and to run this business, at least, even if you are not very business oriented, with little knowledge of business and brushing up your knowledge on business, you can get started. Get registered with the required regulatory bodies like CQC, GPAC, depending on which business venture you want to go into. But I want to tell you that there are lots of options for you in our world today. It's not really easy, especially as a locum. I locum a lot and I know what it takes, negotiating for these shifts, driving to the distance, going to where you don't know every day. It can be boring, it can be exhausting, to be honest. And somebody like me, I like to explore, check out different options, things that excite me really. You can be working and you don't feel like you're working, like you're enjoying what you're doing. You can have that at the start when you began your practice, but as time goes on, you realize that you really need to see something else. You'll be like, is this just it? What is it? Is this the only thing I'm going to be doing every day of my life? So from time to time, you want to diversify, look into other options available there for you, and at times you don't have the knowledge of what other options are out there. So today I'm going to be discussing 10 private clinic services you can do as a pharmacist or even other eligible healthcare professional. Hello, my name is Benita. I'm a pharmacist practicing in the UK. On this space, I discuss everything health, how to make money as a healthcare professional, pharmacy, and everything related to being a pharmacist in the UK. So stay with me. Let's dive into it. You can do a private clinic either online or physical. So it depends on what you want to do. There are a range of services you can offer as someone that has a private clinic. Number 1 is travel clinic. So in travel clinic, you do all the vaccinations, give medical advice, literally everything about travel. So for people to travel, depending on the country they are going to, they need some mandatory vaccinations. Some can be yellow fever, meningitis, a whole lot of them. And these services are not offered under NHS, so they source for it privately. And there are lots of people offering this out there. It's something that you can do as a pharmacist, as a nurse, as a doctor, if you have your own private clinic. So it is worth looking into. There are also specialist clinics depending on your specialty. If you are good in diabetes, hypertension, all those chronic illness, you can offer the clinic where you follow up on people, offer medication review and advice. Because sometimes the waiting hours in these GPs and hospital can take up to 6 months. And most times patients are just looking for where to get this help. They have the money, they want to pay for it, but nobody is offering this service. So even the little ones out there, private service, you see that their waiting time is also increasing because there are a lot of people are not offering these services. And it's not like people are not capable of offering these services. It's because they don't even have the knowledge, the awareness is not there. It's not that they can't do it, but they don't know about it. So if you are a specialist in any area, you can package your knowledge and offer it as a private clinic. It is trending now and is something that can make you cool income if you are really serious about diversifying your career. You can also offer online consultation. This one is trending since COVID. COVID has made it very rampant, but people are going into online consultations now, because how many people want to leave their home to go and queue up in the hospital for what they can, consultation they can easily get from the comforts of their bedroom? So, and this, you are not limited to your local patient. You can reach a whole lot of people globally, because it's something online, and anybody anywhere can, depending on your method, if it's online, if it's phone call or video call, you can reach anybody across the globe. So there is no limitation. You only need to develop your business acumen, register with the required regulatory bodies, and get yourself started. It's that simple. Another one is medication review services. It's a very common practice nowadays for private clinics to offer this service to their patients, because a lot of them are on loads of medication, polypharmacy. The appointment they are getting from the hospital is for another thing, not for medication review. And these people really need their medications to be reviewed. Some they prescribed, some changed, and a whole lot of things that they need. And because of the burden on healthcare system already, they sought for these things privately with their own money. People are ready to pay for you to offer this service, but you have to set up, there has to be a platform for them to pay you for you to do this for them. So it's very rewarding. It's something you can look into. Another one is hormone replacement therapy. Yeah, because women need this. Approaching menopause, everything that comes with all the hormonal changes. GPs, there is not enough room to cater for all this. As someone who has a private clinic, you will stand a better chance to offer this service to the public. So even if you are not an expert in hormone replacement therapy, it takes, one or two courses, brush up your knowledge, know what it's all about, get the required certification, and there you are, you're offering this service to those that need them. There's no way you can run out of clients, because as long as there are women will age, and the need for hormone replacement will always be there as long as there are women in the population. The sixth one is erectile dysfunction services. So a lot of people suffer with this, and at times they don't come online to announce it, or even they are not confident enough to talk to their relatives or even to their personal doctors. They prefer private services where they can do it in secret, and nobody will, very discreet service. So if you are offering online consultation or even physical consultation, you will have clients from this sector as much as you want, because they sought private clinicians to help them with their condition. It's not something they are so proud of to discuss outside. I know lots of them that come. Once they come, I know what they are after, and I don't, without further delay, I know where to take them, and I know what they're about to discuss. So if you have any knowledge, or if you're interested in this sector, it's something you can explore. Hair loss treatment is another trendy one. People losing their hair, alopecia, they use all sorts of vitamins, supplements over the counter. Once it doesn't help, they start to sort for help. And this type of service is not something you find under the NHS. Even if they find something like that, it's going to take ages, if up to 1 year, for them to get an appointment. So instead of waiting that long, they seek the help of online clinicians, private clinics. So if you are offering this in a private clinic, it's something people can benefit from, and you will not run out of clients. That I'm very sure of. Ninth one is private vaccination services. So some services are not available under the NHS, like this shingle vaccine. Those under 70 cannot access it. Even the COVID flu vaccine, you have to qualify some eligibility criteria. But those that do not meet that eligibility criteria, some of them still want to have that vaccination, and they don't mind paying for it. So offering this vaccination in your private clinic, you won't be out of pocket, because in and out of season, people want to get vaccinated for different diseases. So the last but not the least, which seems to be the most common one that the whole world is going crazy about, is the weight loss clinic. So weight loss now is more popular than anything else I know, because any day I go to work, the weight loss medication I dispense will be times 2 of any other medication I'm dispensing. And all these are coming from online doctors. So people in their private clinics prescribe these for patients and they come to the pharmacy to get it. So if you don't have any knowledge on weight loss, it's something a knowledge you can gain. Just apply for the courses, do the courses. I don't think they take long to finish the courses, get the required certification, get the required knowledge as well, and start your online clinic. All these things, they are not rocket science. It's something you can achieve with time. And because you already have that background as a pharmacist, as a nurse, or as a doctor, you stand a better position to do well than somebody starting afresh or does not even have any prior experience in healthcare. So if you explore any of these I've said or even more, it's something that can distract you from your regular job, because those regular job most times they just seem so monotonous. It's something you keep doing every day over and over again. But if you have your own private clinic, apart from working for yourself, being your own boss, you also have something to challenge you, something to make you motivated, like you are eager to go to work to see something new, unlike just doing the same thing over and over again. So if you enjoy this content, please subscribe, share, like, and leave a comment. I hope to see you next time in my next video. Bye.